Thank you for taking a few minutes to watch this video. Our hope is to try to shed some light on how health insurance works. We know it can be terribly confusing when you think about deductibles and co-insurance and co-pays, out-of-pocket, allowable charges. There's a lot of moving parts and pieces. Our hope is to shed a little bit of light on what all of these things mean. As I said, health insurance can be very complex and it can be very confusing. Our hope with this video is just to provide a basic introduction and some education on how health insurance works. We can't explain every subtlety and nuance of how it works, but we can give some basic overview, and hopefully by the end, you'll feel like you have a better grasp of how your insurance company actually processes a claim. We're going to take a few minutes and break it down into some bite-sized pieces. We'll talk about what a premium is, what a deductible is, how co-pays and co-insurance work, and how they're different. We're going to talk about allowable charges, and then we're going to share a couple of examples and try to bring it all together to give real-life examples of how a claim might be processed. Before we begin all that, sometimes understanding the history and a little bit of introduction could be helpful. So remember, when health insurance first came into being, it's relatively new. The first health insurance plans were really workers' compensation plans that started in the early 1900s. And they were really designed to help protect a worker if the company did something that was very negligent, if there were dangerous work conditions and different situations like that. It wasn't until about the mid 1930s during the Great Depression that health insurance as we know it really started out. And what it started out to be was prepaying healthcare costs, trying to help various families and people prepay into a pool that would help them offset future healthcare costs. You also have to remember that in those times, health insurance was never intended to cover 100% of medical expenses. It was really designed if there was something catastrophic, something horrible that happened, people would have some ability to pay for that with some assistance. Health insurance has certainly changed over the years, and the pendulum has swung from one side clear to the other, and now we're trying to find a sweet spot, hopefully somewhere in the middle. Just a little bit of additional history. When health insurance first started, the American Medical Association, which represents physicians in the United States, actually had a statement that they refused to participate because they felt it would be a conflict of interest with their patients. And oh, how times have changed. Doctors and health insurance certainly work hand in hand nowadays. And we also know that there's a lot of different variables with health insurance plans, with hospitals, with employers, with patients. It's very, very complicated. In the 1960s, that's really when the federal government started to enter the picture, and programs like Medicare and Medicaid and the Veterans Administration were created. Today, the vast majority of people, when they're covered by health insurance, their employer typically sponsors the healthcare plan. So that's the majority of insurance in the United States. The second place would be Medicare, and then coming in third place is Medicaid, both federally funded programs. So let's break it down into manageable bite-sized pieces. Let's start with the premium. The premium is how much you pay every month for the privilege of having insurance. Now, you may not view it as a privilege, but compared to most of the world, it certainly is. The premiums in the United States, the majority of premiums and the majority of people have insurance through an employer-sponsored program. So your employer provides some type of health coverage. 50 years ago, it was very common that the employer covered 100% of the cost of those premiums. But over the last 50 years, as insurance costs and procedures continue to get more expensive, employers have passed part of the premium costs onto their employees. So often employers will give an allowance. There's a health insurance premium, and an employer will give so much money each month to help cover some of that premium. If you choose a family plan or different things like this, sometimes more of that premium lands on the actual patient or employee. Now, there's a number of factors that go into determining premium costs. Do you have an individual or a family plan? Is it a lower deductible plan or a higher deductible plan? Higher deductible plan usually has lower premium costs. Some plans won't cover certain types of services. Other plans have a cost sharing built in or co-insurance, and we'll talk more about that in a moment. In the past history or the past year or two in the plan, has coverage been used? Has there been catastrophic events? Did someone in the plan have cancer? Did someone in the plan have a major surgery? This can certainly affect the cost of premiums in the following year. And just overall, the rising costs of healthcare. Everything is more expensive. Therefore, insurance companies continue to raise premiums year over year over year. The real issue is, as premiums continue to go up and deductibles continue to go up, that is not a sustainable system. And for many of our patients, they're feeling that squeeze. So let's talk about the deductible. And I often use an analogy when we talk about insurance scenarios like this of filling a bucket. Deductibles are often very confusing for people, and not everything falls into a perfect category. So what you're going to find, we're going to use an example of an insurance plan that has a $3,000 deductible, which ultimately means you are responsible for paying the first $3,000 in covered medical expenses. Nowadays, we're seeing many insurance plans that actually have a couple different types of deductibles, and this adds to some confusion. You may have an individual deductible as well as a family deductible on your insurance plan. The rule of thumb is this: if the family deductible has been met, the individual deductible no longer applies. The individual deductible is always going to be smaller than the family deductible. The most common example of this, if you have a family of 5 people, there's a husband, there's a wife, and there's 3 children. If something happens and the husband needs to seek out medical care and has a $1,500 individual deductible, and that person meets that, then their co-insurance will start to kick in. If someone else in the family gets hurt and contributes to that healthcare pool, now the deductible might be for a family $3,000, and so there'll be more out-of-pocket costs for that second person until they hit the family deductible level. I've given an example down below, and just for the sake of time, we'll try to keep this short. But if you end up going to the emergency room and you have multiple things done, all of those things will go in and fill the bucket until you meet either that individual or family deductible. This brings up the next topic, which often causes confusion: the idea of a copay. A copay is a fixed amount for specific healthcare services. It's often a very round amount, such as $20, $25, maybe even $50. And each time you participate in healthcare in a service, you may have to pay a copay. The idea of a copay is we use the term skin in the game. The insurance company wants to make sure people are thinking about their healthcare benefits and using them wisely. By having a copay, the patient is actively participating in their healthcare and thinking about some of the dollars and cents that go into it. This is different than coinsurance. Coinsurance is often part of your overall plan. Many people have an 80-20 plan. Some people have a really good plan. It might be 90-10. Some people might have a 70-30 plan. It just depends on which plan you've chosen. Let's use an example of an 80-20 plan. After you meet your deductible, we've filled up that bucket to a certain point. Let's say it's about the halfway point. Now, each time that you seek out medical care, whether it be physical therapy, your family doctor, whatever it might be, you are not 100% responsible for that bill. You're now 20% responsible, and the insurance company is going to pay the other 80%. At some point, if you fill that bucket up full enough, you're going to hit what's called maximum out of pocket. And we'll circle back to that in just a minute. Before we get to maximum out of pocket and we give a couple of examples, I also want to talk about from a therapist perspective or from your doctor's perspective, this idea of what are called allowable charges. So every medical practice has what is called a fee schedule. We've determined all the procedures we do, all of the things that we can offer. There are codes associated with those, and we communicate with your insurance company through these codes. And we've determined we believe this code is worth X number of dollars. So every individual provider has to determine a fee schedule. Now, we actually have very little control over what the fee schedule is because each individual insurance company then determines what they think is an allowable charge. So based on the code that we've chosen, the procedure that we're doing, I'll give an example. We may think that's worth $60. Your insurance company has an established fee schedule and allowable charges, and they decide that that's worth $45. We sign a contract with your insurance company that states we will accept $45. But this often is very confusing for patients when they look at their EOB, their explanation of benefits they get from the insurance company. You'll see what we charged, what the allowable charge is, and in this case, if we charge 60 and the allowable charge is 45, we at Homestead Physical Therapy will write off $15. That $15 is gone. It is not passed on to the patient. That is our contractual agreement with your insurance company. We are willing to accept $45 for that particular procedure. This is the part that confuses patients. You are not responsible for that $15. Our contract with Blue Cross, as an example, says we will accept $45. So let's try to put all of this together just to help understand in the big picture. So here's my bucket example again. And we're going to talk about a deductible, copay, and coinsurance, all contributing to filling that bucket. So remember, the deductible, you pay for 100% of covered healthcare services out of your pocket until you reach the deductible. Once you've met the deductible, your insurance plan will begin to share the cost of covered services. The copay doesn't always apply, but in many cases it does. And for some services, you're going to pay a fixed copay each time you go see the doctor, therapist, whatever it might be. And that's regardless of whether you've reached your deductible or not. And the coinsurance, after we've reached the deductible, you'll typically pay a percentage of the cost for your covered services. Eventually, that bucket could fill up. And if that happens, most insurance plans have a threshold that says now insurance will cover 100% of future charges. So just to make it visual for some folks, I want you to think of that copay, deductible, that's the bottom of the bucket. That's generally 100% the patient's responsibility. That next layer could include copays and coinsurance. And in this case, it's an 80-20 plan. So 20% of allowable charges are going to be the patient's responsibility. And maybe you have an $8,000 maximum out of pocket. When you have spent $8,000 of your personal money in your health insurance, now insurance will cover that at 100%. So let's use a simple example similar to the one I used earlier. The insurance company contract that we have says they will pay $45 for a service, even though our charge is $60. Therefore, $15 is simply written off by Homestead Physical Therapy. If you've not met your deductible, you're responsible for that entire $45. If you have met your deductible and you have a $20 copay and an 80-20 plan, then you would pay your $20 copay, and then you would pay the remaining 20% of $25 because we take that $20 copay out, so it would be $5. So your total out-of-pocket cost for that day would be $25. $20 copay plus $5 of coinsurance. Hopefully that makes sense. Let's use a little larger example. So in a bigger example, let's say you have a $3,000 deductible, a $20 copay for PT and doctor visits, and a 20% coinsurance rate. And you went to see your doctor or your therapist, and the total bill that day was $150 of allowable costs. Before meeting your deductible, you would literally pay $150 out of your pocket. After meeting your deductible, you'll pay your $20 copay plus 20% of the remaining $130, which is $26. Your insurance would cover the remaining $104. So your out-of-pocket cost for that visit would be $46 total. Hopefully that helps shed some light on a very confusing topic. So how do I know? This is one of the questions we get asked all the time. This is hopefully something we are bringing to the table to help add some value to your healthcare experience. Homestead PT has invested in great software, and it does an excellent job of tracking all of this for you. It tracks the charges, it tracks the insurance reimbursement, and just about everything else you can imagine when it comes to medical billing. Our software tracks all of that. We also utilize very highly skilled third-party medical billers. We want to make sure that we're always up to date with new rules and regulations. These things change constantly in the world of insurance. It's very difficult to stay on top of that. So we actually use third-party companies. This is all they do is medical billing. We also try to make sure that everything we do has total transparency, so you feel like you are informed and educated every step of the way. We check on all of your benefits ahead of time before you ever come to the clinic. We want to make sure we have as much information from your insurance company as possible so you can make an informed decision. You can always request a copy of what is called the ledger at any time. The ledger shows every visit, every charge, every allowable. It has all the detail. You can request that at any time so you know exactly what the charges were for each and every visit, and then exactly what you paid on each and every visit. So to wrap it all up, health insurance plans can be quite complicated and they can vary significantly in terms of deductibles, co-pays, co-insurances, allowable charges. At Homestead Physical Therapy, we always want to contact your insurance company, check on your benefits, and keep you informed. But I have to tell you, ultimately, it's always our patient's responsibility to know what their benefits are. We always encourage everybody, contact your insurance company so you hear it straight from them. You might be surprised at how often when we call an insurance company and they actually give us inaccurate information. Our team is very well trained. They try to double and triple check these things, but at the end of the day, we can only work with the information we're given. So please, please always make sure to check with your insurance company to fully understand your benefits. If you ever have questions or concerns, you can always contact us, come by the clinic, call the clinic. We are happy to research and help and try to solve any problems when it comes to insurance and understanding how your benefits work. Thank you so much.